Guys!
Right.
I'm here with my friend Sam. Sam, please introduce yourself for my people here on Instagram.
All right, hi. My name is Samuel Mogeke. I work with APA Insurance in the medical section.
Okay.
I head the individual business, family business.
You've heard him saying he works in the medical department, which is what we're doing here today. A couple of days ago, I asked you guys to send in any questions you might have for APA Insurance. Thank you for everybody who responded. Those questions were so many, so good, so good, that APA was able to host me today so we can answer them in depth. Sam, what exactly is insurance?
Right, that's a good question.
Yeah.
Now, insurance is a financial service that is based on a desire to fulfill uncertainties, financial uncertainties. Now, one of the things insurance demands is that, one, you have a financial interest in that thing, which if you lose it, we are able to measure what you lost, how much it was, and that it was yours. You have a financial interest, you bought it, right? Then plus that, we are able, one, to get a value.
Yeah.
So if you lose it, we can pay you back.
Okay.
So insurance basically is around the financial uncertainties. We use a particular word called indemnity, which means taking you back to where you were before the loss.
Yeah.
So one, there has to be a loss.
Yeah.
Then we want to take you back there just before the loss, financially.
Okay.
So if it's your car, how much was it worth? What was the value of that car before the loss? So that we are able to take you back.
You're talking about tangible things, though. What value do you put on my life or on my health?
That's a very good question. Now, when we come to medical insurance, what is the indemnity? What is it you're losing that we are able to take you back? So when we come to health, what we are looking at is the financial loss, as it were, the money you spent to get yourself back to good health. So insurance comes in and says, I am going to do this. Your problem is uncertainty. Sell me that uncertainty at a premium. You know, you're going to pay me a premium, and I'm going to take up that discomfort. Let me help you manage that. Yes. Let me give you peace of mind that should you fall sick, should you need to see a doctor, I will pay your bills. So what you do then, we trade. You give me a premium, I give you a promise.
A premium?
I want to call it
for a promise.
Yes. And this promise, we put a value to it. You're buying 10 million, 5 million, 2 million. I'm promising that when you get sick, if you get sick, I'll pay your bills to this limit, the limit you bought. You have uncertainties, financial obligations you want to take care of. You're not sure how to measure them. Then I sell you a promise that has a value on it, and I tell you, I will pay your bills should you get sick to these limits.
Wow. So Sam, when's the best time to get insurance?
Oh, now.
Now, or yesterday, or 10, I like to say 10 years ago.
Well, true, 10 years ago.
What exactly do you cover under your health insurance?
Yes.
This health cover.
So first, what do we cover? Our main cover is inpatient. Inpatient means admission. Now, an accident, not necessarily road traffic accident, they will tend to lead to an admission. See that? So, and then the costs involved are higher. So when you look at an individual, some may say, you know what, I can pay for my outpatient. They're not that expensive. I mean, it's maybe 500 here, 1,000 there. I can manage that. But inpatient can take you down. You know? So there is inpatient and then outpatient. So once you buy inpatient, let me be very clear. Once doesn't mean you come back after 3 months. As you're making your decision, you're first buying inpatient, to inpatient, you add outpatient. All right? So because you're going to buy it at the same time. It's one policy, starting at the same time. So inpatient, outpatient. Now, on outpatient, dental and optical are riders to outpatient. What that means is you cannot buy dental optical with inpatient. Maternity stands on its own, so you can buy inpatient and maternity. You don't have to have outpatient. But you can't buy in maternity dental optical. See that? So it's in outpatient dental optical with maternity, or in and maternity. All right.
And just to clarify for the ladies here, you cannot also buy your maternity cover when you're pregnant. That's not the time to get it. Will you be able to give it to me? You can.
I can.
You would cover that child.
Yes. So the idea is, again, it's an issue of planning.
Yeah.
So you're like, let's put it this way. Our maternity cover, just like a number of other things we look at, has a waiting period.
Yes.
That means if you buy today,
yeah,
it has a 12 months waiting period.
Yeah.
That basically means the first year, if you deliver, you will have to pay, not from this policy, maybe another policy,
yeah,
but this one will not respond.
Yeah.
So it's from year 2.
All right.
Yeah. So the idea is buy early. So
Yeah.
if you buy your policy today, you'll have to wait 30 days before you can use it,
What's
even
an
for a
acute
cough
condition?
or for
Oh,
malaria.
okay.
You will not pay.
Okay.
90 days
Yeah.
for surgical conditions.
All right.
Yeah.
All right.
So the policy will have to run
All right.
for 90 days
All right.
before we pay for a surgical condition.
All right.
That's year 1.
Okay.
So what is going to year 2
Yes.
are the pre-existing,
Yes.
the chronic
Congenital.
conditions, congenital
Okay.
and all that. Yes.
Sam, someone has asked, do you cover Kenyans in the diaspora?
Yes and no.
Yeah.
Well, one, our medical cover
Yeah.
is the legal jurisdiction of the cover
Yeah.
is Kenya. So there is a period to which we can extend our cover.
Okay.
So for example, if you're traveling outside the country,
Yeah.
we can cover you up to 6 weeks in a year.
And this isn't me getting travel insurance separately.
This is not, yeah,
still my medical
yeah.
insurance.
But you traveling and coming back.
Yeah.
Diaspora, because you're living there,
Yeah.
it's no.
Yeah.
You're there longer,
Yeah.
and therefore this policy won't work for you.
Okay.
Yeah. And again, we're looking at the costs of treatment are different.
Yeah.
The policy has been constructed with the background of Kenya.
Yeah.
So out there,
Yeah.
the dollar, the Kenya shilling
Yeah.
values are different.
Yeah.
So we can only cover you when you're traveling for a short period.
Yeah.
But if you're living there, then you are better advised to
Yeah.
buy a local cover there.
Okay.
Now, we have people in the diaspora,
Yeah.
my yes, where I said yes,
Yes.
buying cover for their people here.
Yeah. A couple of people have asked, do you cover gym memberships?
Not right now.
Yeah.
It's where we are planning to go.
Okay. How about me as a lady?
Yes.
I'm about to turn 40 and some things are sagging. And I need them to be packed up. Do you cover cosmetic surgery?
Man, we like you, Sergeant.
What are you saying?
You know what?
You don't cover cosmetic surgery?
We don't cover cosmetic.
I can go get a boob job and pay with my insurance cover?
You know the funny thing with that?
Tummy tuck?
You can.
Yeah.
Nobody's saying you can.
But
insurance won't take care of it.
If you won't take care of it, or generally,
Insurance
does not
won't.
cover cosmetic
Let me tell you what
surgery.
we cover under cosmetic.
Yeah.
If it's as a result.
Yeah.
Now, let's say the situation, the condition that needs to be addressed, right? If it's as a result of an accident, you see that?
All right.
The accident
like
is covered.
reconstruction,
Yes.
skin graft.
Yes.
Okay. You had talked about dental, so I'm guessing if my dentist tells me I need braces, you will cover that for me because you guys know braces are very expensive.
Yes.
Good.
Now, do we cover that?
Do you?
We cover if it's an accident.
Wow.
Yes.
Mental health is a very important thing nowadays.
Yes.
Do you cover sessions with therapists or psychologists? Do you cover that?
Yes, we do. Yes, we do. It's within inpatient, and it could also be on your outpatient.
Okay.
All right.
Can students get a personal cover? If so, what is the age limit for a student? Isn't it? Is there an age limit?
Under corporate covers,
Yeah.
there is a maximum.
Yeah.
Like let's say you are a dependent
Yeah.
up to 18 years.
Okay.
And then ideally you should fall off.
Okay.
And then within corporate covers, we extend it to 25 years.
Okay.
With proof of schooling.
With proof of schooling.
Yes.
Okay.
So there's got to be active schooling.
Okay.
On family covers,
Yes.
we don't use the same measure.
Yeah.
What we've done, our age limit for children, so to speak, is up to 20. All right? So after 20, they need to buy their own cover.
I'm here to get insurance and I don't have NHIF. You won't chase me away.
We will sell you this, but we will not pay what NHIF
It's
would
supposed
have
to
paid.
be. All right,
So
understood.
it's recommended that you have it.
This was a very interesting question. Is there a group option for chairmans?
Yes. Depending on the numbers.
Yeah.
If the numbers are not that high,
Yeah.
then each one of them will have to buy a Jamii Plus cover, you know, like on a personal level, and then the Chama will pay. But if they want to buy under the Chama umbrella, then of course there's the registration documents and all that, and then we'll give them a quotation depending on their numbers.
So only to register chairmans. An
Yes.
unregistered chairman will not
No,
be able
just
to
buy as
benefit.
ours, yeah,
All right.
yeah.
Do you cover hormone profiling and subsequent treatment? If a woman is not able to have a child and she decides to go for IVF treatment, does insurance cover IVF treatment?
No.
Wow.
We don't.
Yeah.
Yeah. So even what you said, hormone profiling and all that,
Yeah.
it won't be covered.
Okay.
Yeah. Because again, illness, accident.
Wow.
Yeah. And
If by accident,
yeah. If by accident?
I can't have babies.
Well, I appreciate what you're saying. If you get involved in an accident and
my uterus is messed up,
well, we will pay for the costs of treating
the treatment,
you.
but in terms of now
of getting a baby,
I've tried, guys. I've tried. Ladies, I've tried. That means birth control. You don't cover that.
Yeah, you don't.
That's for you to cover birth control. What does APA do in terms of COVID and even maybe future pandemics and this type of stuff?
Okay.
Yeah.
Now, we don't cover self-quarantine.
Okay.
All right. Now, there are, as you say, testing.
Yes.
Somebody may be like, no, I'm feeling funny.
Yes.
Maybe something happened. Yes. I need to check and all that. Yeah. We also do not cover testing.
Oh.
Yeah.
Okay.
But if there is a treatment required, like somebody's in a state where they need to be treated, because the other thing that has been understood, especially where you're having underlying conditions like pre-existing chronic conditions, then it compromises and things can get really bad.
Exactly.
So you find that someone who already had a condition, because of this exposure, requires treatment. So we cover treatment.
All right.
So if somebody is admitted in hospital for COVID-19 and there is need for treatment, the policy pays.
So my final question, where does insurance come in terms of covering a funeral, even just the funeral?
Okay.
Where does insurance come in? Not this guy has died in hospital, then you guys have taken care of that bill. But the guy has died, yes. Do you guys help with funeral expenses?
All right.
Yeah.
When you buy the Jamii Plus cover, within Jamii Plus, we have provision for funeral.
Yes.
There's a limit that is paid out. Yes. The only thing I may have to bring up is that it is pegged on there being a balance on your inpatient should this person pass on. Okay. Remember, your limit, for example, is 500,000, or that person's limit is 500,000, and they're admitted in hospital. Yeah. So if they pass on and there is a balance before they exhaust that inpatient, then we will pay out to the tune of what we have promised under that. But if the limit has run out, then there wouldn't be. Now, let me also add this: in the Apollo group, we do have funeral covers. You can buy a funeral cover from APA Life. We have a product for that, Pumzisha, which is ideally designed to take care of the last expense benefits. Yeah. So in the medical section, we are not selling that currently, but in our life section, we do have a Pumzisha cover, which is tailored towards that. Okay. Yeah.
Fantastic. Wow. Hey guys, leo tumeongea insurance. I have learned so much. I have learned so much, Sam. Thank you so much for taking time out of our work day. These guys are in the offices working. You need to respect some of this. Thank you so much for taking time out of your work day to educate myself and my people on insurance. Guys, I'll leave the link in my bio for you to access their Jamii Plus cover. If you have any questions, please drop them in the comments. Until next time, bye.
Thank you.